webinar. The webinar's on, as it says, road safety in low and middle income countries, with a particular focus on the next 10 years. For those who don't know me, my name is Brian Fildes. I'm a research professor at Monash University, the Accident Research Centre, and amongst some of my sins, I've been a former president of AAAM as well. And it's also my pleasure to be the monitor for this session. Now, hopefully this will work. I thought we'd just start off by looking at the extent of the problem that road safety faces, both in low, middle and high income countries as well. The World Health Organization last estimates are that around 1.3 million people are killed every year from global road crashes, and another 20 to 50 million severely injured or disabled. So it's a greater problem actually right now than COVID, but nevertheless, let's not get into that. 90% of all these deaths and serious injuries occur in low and middle income countries, which is terrible. And while there's been a decrease, I guess, in deaths in high income countries, at least some of the high income countries, this is not the case in low and middle income countries, and particularly in low income countries. So this is really a very important initiative. And death and serious injury rates in these low and middle income regions are expected to increase by 60 to 80% over the next 20 years if we do nothing about it. So we've got a real challenge. Now, the next decade, 10 years, is really what the focus of the AAAM conference this year is all about. And so we've picked up on that in the webinar. The third ministerial conference, it was held in Stockholm in February, I believe, this year, initiated a call for a 50% reduction in death and severe injuries by 2030. And you'll hear more about that as we go through. And more recently than that, the United Nations General Assembly have endorsed a second decade of action that in doing so has adopted the 50% reduction. The claim is that while it's ambitious, it will be achievable. But the question I guess that we've got to face tonight is this really possible? That is, a 50% reduction is really possible given the history of low and middle income countries. And if it is, and hopefully at least some improvements can be made, then what do we need to really achieve this ambitious target? So tonight we've actually assembled four very experienced, sorry, I've got to get this thing out of my way, very experienced panel members to discuss the topic. Professor Claes Tingvall, who is the former director of the Swedish Transport Authority and well known for his pioneering work in terms of Vision Zero for not only Sweden, but other countries in Europe as well. Lotte Brondu is the executive director of the Global Alliance for NGOs for Road Safety, and they're based in Geneva. Dr. Blair Turner is an expert consultant with the Global Road Safety Facility and the World Bank, and based now in Washington. And finally, Olive Kobusingy, hope I got that right, Olive, is an emergency surgeon and also based in Makerere University in Uganda. So all of these people have got a lot to contribute to this topic. Now, before we start, I'd just like to explain the format of this webinar and your participation. So each panelist will give a 15-minute presentation on their selected topic, and that'll go without interruption. So it'll be just a smooth flow. After that, no questions, I should say. After that, we will then move to the 30-minute Q&A session, where you can ask your questions to any of the presenters or the topic generally. To do that, you can use the chat facility, which is in the bar at the bottom of the screen. Make your questions brief, please. They should be directed to everyone, which is one of the default features of the chat system. So Professor Frank Pintar, who's with us, will conduct the Q&A session. So he'll be the one who's monitoring your chat questions and will raise them in the session as we, in the last 30-minute session.
Brian?
Yes?
I think we want the questions into the question and answer. There's a separate question and answer.
I'm sorry.
Box.
Okay.
Is that right, Katie?
You are correct. You can put them in either. The Q&A is a little bit easier to navigate, but we'll take them from the chat as well.
So I would encourage all the listeners, the participants, if they have questions along the way, that they just go ahead and write them in there, and then in the end we will address them to whoever they are directed to. Thank you.
Yeah, and if we don't actually have time, and I'm sure we won't, to get through all of the questions, then at least we'll have a record, and we'll try and follow those up as much as we can after tonight. And the session is being recorded, so it will be accessible, I think, on the AAAM website sometime after today. I'm not sure when, but maybe Katie or Colleen might be able to tell us that. Okay. All right, let's move on, get started. So the first presentation is from Professor Claes Tingvall, Saving Lives Beyond 2020, the Next Steps. So it's over to you, Claes. You'll have to unmute your...
Yeah, thank you, Brian, and hello, everyone. I'm sitting now here in Sweden, and of course wish to see you all, but this is the way we need to handle things today. Anyway, I'll make a presentation very much based on a report that myself and a group of 13 experts from across the world, Kobusingy was one of them, by the way, produced before the ministerial conference that Brian talked about that was held in Sweden in February, just before the sort of big outbreak. So we were almost 2,000 people assembled in Stockholm, and from sort of all parts of the world, discussing the next decade of action, and what should be done. And from that also came the Stockholm Declaration, and that was also the basis for the UN General Assembly resolution that was taken by the General Assembly just over a month ago, or a little bit more than a month ago. So I'll sort of try to get a little bit deeper into what we as an expert group recommended sort of the conference and if I may call it so, the world to do, and in particular, of course, the kind of recommendations that would add to the ones that we already have around the world, and of course also, if I can add the next slides to next slide, yes, thank you. What this is really about, the conference and the second decade of action and the whole thing happening now up to 2030, is really to seriously adopt and understand what we can do when we are now a part of the 2030 agenda, the SDGs, the Strategic Development Goals, which really sort of tells us where to go, and where I think all states around, all countries around the world, except one or two, has signed. And where it is important, if you can continue on this slide, it's important to understand now what this really means for us in the traffic safety and the road safety sector. Because this is big and this is really a major step. One of the probably largest step we've taken in terms of moving the world forward in terms of safety and traffic safety. But understanding then that this is, it's not only that we have a target since 2015 about traffic safety, but all the instruments, the possibilities, and what it really means to be a part of the 2030 agenda. And one of the absolutely most important parts is, of course, that the goals in the SDG, and there are sort of 17 big ones, but 169 more detailed goals, that they are absolute and indivisible, which to us and to me working in the transport sector means that the 100 years of trade-off between mobility, safety, environment, accessibility, and things like that is sort of over. You can't trade off different kinds of targets to each other. But it also means, of course, that it is only scientific based or things that we know from sort of evidence-based knowledge that we could use in the prevention work. It means also that we are a part of the family of health, climate, and equity, which is an enormous family, of course, when we're talking about the really sort of big challenges of the world. We are a part of that, and we should be a part of that. But also things like, you know, we don't divide any longer the world in saying, you know, it is the public organizations that rules the world and the private should only follow rules and regulation. The private sector must be seen as an organization in partnership where you expect the private sector to do things in relation to the 2030 agenda, even if there is no regulation, legislation, or whatever it means out there. This is so important to know, and all these sort of parts are so important to understand for us. Next slide, please. And if I can mention just a couple of them in particular, as I said, it's not the most important thing that there is a goal for traffic safety that's now been sort of in reality prolonged to 2030. With a 50% reduction of deaths and serious injury. But the more important ones are maybe those, for example, in what is called the target area 12, which says that companies should adopt sustainable practices and to integrate sustainability information into the reporting cycle, or that public procurement should be done in a way where you sort of stimulate sustainability in terms of whatever you do in what you procure, and especially in public procurement. And knowing that public procurement in most parts of the world is between maybe 20% or up to 20% of the GDP means that these are enormous resources, of course. And that's why we no longer talk about, you know, that traffic safety needs a huge budget on itself. It's really picking in other pockets and understanding that there are so much resources out there, even in sort of all parts of the world that we can utilize. And at least for me and for the expert group, it became more and more obvious that be a part of the 20th and 30th agenda will probably benefit low and middle income countries more this time than what it used to be doing. A little bit complex, of course, to understand that, but so important to really understand that there are so many possibilities in using these kinds of these kind of instruments that are no longer dependent only on if you have weak or strong institutions in a society, but rather where do the big money operate in our world? Where do the sort of Where are things produced? Where the value chains of a lot of corporations start? These are things that we need to understand so much more. So I can have the next slide, please. So we brought up 9 different recommendations. They are sort of very much dependent on each other. And I won't go through them in any detail. We don't have that kind of time. But just to say that they're all the time, they start off with that the reason for doing things is not only traffic safety. It is also its health, it could be climate, it could be livability, it could be other things that are part of the 2030 agenda, which means there's so many more arguments, so many more reasons to act, but also that we in the road safety culture needs to understand so much more about other needs of the future. As I said, with climate, with air quality or water quality or with equity, things we should be knowing much more about in the future than what we know today in our community. So this is about modal shift, for example, and it's not only about getting people on the bike or walking and things like that. It is how we organize our society so it becomes more both safer and other sort of qualities that needs to be there so that people feel that it's attractive to walk and bicycle. We can see that now during the pandemic, for example, how very quickly people have, in some at least parts of the world, and especially in major cities, has changed their way of transporting themselves around. Next one, please. Another one I just hinted at was about, and this is one of the most stimulating and fantastic recommendation, it is about sustainable practices and reporting. It's about how the financial sector operates in terms of where do the big money go? Where do the retirement funds or life insurances or whatever it might be, where do they put their money in order to get revenue from them? And they won't put it into companies or large corporations that will destroy our world, because that's not going to be a very sensible way of making sure your money is secure. They are asking more and more questions about sustainability, about climate, and how you're going to tackle the next 10 years. And of course, now we are a part of that. Traffic safety is a part of sustainable practices and reporting. And we need to, and we know, for example, that FIA is now developing some kind of a reporting structure for the large corporations and the manufacturers of different kinds of things and services and so on, to make sure this could be done in a way that makes sense and based on scientific evidence and things like that. Next slide, please. Procurement, as I said, one of the absolutely biggest sort of engines of the world, and happens everywhere in low and middle income countries at the same extent as in sort of the high income countries. So important to use that kind of instrument for safety as well, and not only for other things, and so easy to use this kind of instrument, of course. Next slide, please. Vehicles, I mean, now today we know there is absolutely no reason to sell cars with and buses and trucks and things like that with different standards across the world. The safer ones don't cost more money to produce, and they should and must be available across the world, and especially in procurement, in rental cars. We know, for example, that 10% of the world car production goes to 5 large corporations. Of course, they play an enormous role out there, what they do. Next one, please. This one is very important and very interesting to understand. In many countries, low, middle income countries, as well as high income countries, children are not exercising, walking, moving around as they used to do, simply because it's not safe enough, and security is not, especially in the transport system, is not there. So to promote health for children and young people, of course, you need to do things to the environment, the road safety and the environment, to make sure. This is where sort of safety and health becomes one thing together. Next one, please. Infrastructure, of course, and I think we should understand more and more that doing treatments for safety for infrastructure is not so much about money, it's about knowledge. Next one, please. And to be very, this is one of the things that sort of we were maybe very clear, and it's about, there's no other reason than having a 30 km/h speed limit in areas where vulnerable road users and others coexist. Next one, please. And for corporations and those who are operating the road transport system professionally in one way or another, of course, those corporations, those companies, those state authorities and so on, shouldn't have any tolerance when we're talking about speed. One of the major factor in terms of safety, controlling kinetic energy. Next one, please. And the last one, technology. And we're not talking about the most fancy technology or like self-driving vehicles. We're using, for example, to use connectivity to create geofencing for speed and for other things. That could be done wherever we are in the world. And those are the things that we believe could really make an impact out there. So just sort of not summarizing, but just to say, you know, this is something new. This is something quite different. There's so many things in there we can do that we haven't been able to do before, simply because we don't have that set of allies and tools and processes that we have now with the adoption of safety being a part of the 2030 agenda. Thank you very much.
Thank you, Claes. Let's move on quickly to our next speaker, who is Lotte Brondu. As I mentioned earlier, she will talk about the UN resolution, the second decade of action for road safety. So over to you, Lotte.
Thank you. Thank you very much. Let's just see. I guess you're putting my slides up now.
Have you not got it up?
I can't see it.
Okay. Can others see it?
You see it? Okay, let me just see what I can do. Yeah, there it is. Okay, thank you very much. Next slide, please. That's my name here. I'm from the Global Alliance NGOs for Road Safety, and we are a network organization, global network organization who was set up by WHO when the first decade of action started. I say here 240 plus, we're actually 249 members. I've just counted this morning in 92 countries. And if you look at this map, this is where they are. This is a distribution, the regional distribution and representation of the NGOs in our network. And you can see we are equally represented in Africa, Europe, and Americas, where there are less members is in the Western Pacific, in Southeast Asia, and also in the Mediterranean. And AAAM was just accepted as a member here last month. So welcome to this very energetic group of NGOs. Next slide, please. This is the group, and this is from one of our global meetings that we hold every 2 years, and where we bring all our members together. And you can imagine it's like a powerhouse when all these NGOs are in the same room. And what you can also see is that they all have a signboard which says 50 by 30, and this was part of campaigning for the new UN resolution and also the Stockholm Declaration. And before we move into the next slide, I just want to dwell a little bit on this, and this is the UN resolution that I am going to talk about. Really what a UN resolution is and why this is an important piece of paper. The UN resolution, a resolution of the UN is a result of extensive discussions between the world's governments. It's done over long time, and it's usually people come and they sit down and they negotiate every single sentence. This time it was very much inspired by the Stockholm Declaration and the work that Claes have done. But that doesn't mean that it was an easy piece of work to do. You can imagine when you have all these governments coming together, they're coming with different angles. There's a political one, there's someone with economical impacts, there's compromises, there's some with high ambitions, some want to move fast, some want to move slower, some have a lot of resources, some are taking it from an advocacy angle, some are coming from a more technical way, and all these compromises have to fit into this document, and they have to agree on this text. And if you take us to the next slide, please. I have here outlined some of the content from this UN resolution, and it was adopted in the beginning of September 2020. It's a 9-page long document, and if you have a chance, I think you should really take the time to read through it. It's quite interesting, and it's not that difficult read. As I said, well, so there's like 2 parts of this document. There's a part that looks back, where you say this is what we have done, and looking back at the past decade of action that went from 11 up to 20. Looking what have happened. So that's called the preamble. And then the second part, which is more the operational part, which is saying what should we do moving on. And within those 2 parts, there are sort of 3 grouped. I have tried to group what I have seen sort of coming out of the 9 pages of the UN resolution. And the first, and of course there's many more things I could have picked up, but it had to fit into one slide here. The first one is the proclamation of the second decade of action from 21 to 30, which is of huge importance. The second part, and then it has a target, and this target is new. We never had a target before. There was never a target in the first resolution, so it's quite a positive here. The declaration of a decade of action, but also coming with a specific target. Then there is this request to prepare a plan of action. In the first decade of action, there was declared a decade of action, but there wasn't any call for making any plans of what that should look like. So the fact that there is a request to prepare a plan is quite significant in this resolution. And the third thing I have picked up is this high-level meeting with heads of state, which is also one of the international commitments that are in the resolution. A high-level meeting is a meeting that takes place the day before the UN Assembly. And it's a one-day meeting. The heads of state are already in New York for the UN Assembly, and then they've picked one topic of importance for the heads of state to discuss. And here there is a request to have a heads of state meeting on road safety by the end of the 22, and that means that that's going to be the topic that are going to be discussed, and that's quite important because it's the first time that really we have elevated to that level. So I'm going to talk a little bit about bindingness and why this international commitments in a while, but the second part that of the resolution takes is more sort of what you can say the classical road safety issues around vulnerable road users, sort of safe system, the road safety areas that we sort of know of, driver standards, infrastructure, trauma care, that kind of things, which is very much sort of the safe system areas. And the new thing that comes from the Stockholm Declaration and the work that Claes' group and Olive's group have worked on is that spin that came from the Stockholm Declaration, and that's sort of taking the safe system. It's mentioned there. It's looking at the sustainable transport, safe mobility aspects, which is also a new area that are introduced here. It's also the holistic view and bringing in the SDGs and sort of the partnership and looking at the SDG as a broad issue that we all need to connect with, not seeing road safety as a silo subject. And then it's the call for collaboration with other stakeholders. And Claes also talked about the private sector and all the responsibilities, putting the responsibilities on different groups. So sort of three areas there that the international commitments, the more traditional part, and then the spin from Stockholm. I just next slide, please. So we have done some work on what did our members, all the 249 members in 92 countries, what did they sort of get out of this, and what is their take on this, and they have agreed that it's a very strong resolution. The fact that there is a target that we all set to reach is quite strong. It's elevating road safety to a topic of importance, which gives us that hook for advocacy, that mandate to do advocacy, which is the core for NGOs. Also the fact that it connects with the SDG issues, the partnership area, and then funding. And you know, it's the first time that funding is actually mentioned. And I know Claes says that's sort of the cross-cutting issue there. And I know Sweden is very good at that, and probably also my country, that you're not having a separate budget line for road safety, but it's incorporated into the bigger budgets. But the fact that there is a call for funding is quite important. It's new and it's never been there before. It's not that necessarily, you know, then everybody will come running and give funding for this, but it's not that it necessarily leads to funding, but it's there now, and that's the significant part of that. If you take the next slide, we had some conversations with our members, and you can see the sample size is not that big, but we asked them, how do you feel about the resolution? What is your take on the resolution? And you can see here the distribution of replies and what people said about that. And if you take us to the next slide, we also said how do you feel your government is on board on this? How prepared do you think your government is here? And you can also see that it's sort of semi-on. And if you give us the next slide, you can actually, we can see which countries sponsored the resolution. And this is, it might not actually be the latest one, because what happens is that some countries add their sponsorship later. And I just wanted, I promised I wanted to touch on this bindingness and being, how you know, sort of bindingness of this. It's not a binding document. A resolution is not binding. It's not that we can come after the governments and hit them and say, you know, you promised this. It's not legally binding, but the international parts of this, for example, the endorsement of the Stockholm Declaration, the decade of action, the specific targets, the high level meeting, the heads of state meeting, and the plan, that's binding. That's international binding areas in the resolution. That means it's binding by the UN. It's not binding by individual countries, but it's binding by the collected number of countries by the UN. Again, it's not the individual countries who are promising or accountable to this, but there is a level of sort of expectation and memorial obligation that once you have sponsored this resolution, you are also expected to follow through on it. And this sponsorship area is quite important, because it's the process of the UN is that there is countries have to sign up to sort of be part of drafting the text, and it is required for the text to go through, make it to the assembly, to the General Assembly. So countries are sponsoring the text, are part of drafting it, and lead the consultation, the development of the text, and then it's passed on to the General Assembly. And those countries that you see here are those countries who sponsored the text. 60 countries. And I just, we just at the Alliance here, we went through it's 60 countries. It's 36 countries from the Euro region, where 34 of them are high income countries. We have 9 low and middle income countries. We have 4 low income countries, 6 countries in Africa, 4 in the Americas. Americas is, and this is the regions, WHO regions I'm referring to. 26 out of 27 countries in EU are represented as sponsors. Hungary are the only one that are not. It's just, again, it doesn't really say much, but it says that, again, it's not even binding to the sponsors, but again, it tells us that there is an expectation of leadership from these countries, both domestically but also internationally, to move forward with the text in this resolution. Could you give me the next slide, please? Because this moving forward and these countries and being focused of intense advocacy, that's one of the things that we have picked up here at the Alliance, again, mobilizing the NGOs to do advocacy. And next slide, please. We have to build a campaign that we call Commit to Act. We did that up to Stockholm, where the purpose of that campaign was to get as many ministers to Stockholm and be part of the of that meeting and commit to road safety in their countries. The second part of this campaign has been done based on the Stockholm Declaration, based on the UN resolution, and based on the previous campaigns. And also with a view, how do we achieve the 50 by 30 goals that we are set out to do? And there was a call from the members and from the NGOs to have a coordinated campaign where we could relaunch the Decade of Action and the Stockholm Declaration. And we went through a lot of consultations with our members where we asked them, what did the Stockholm Declaration mean to you? What demands are what do you see the demands are in the Stockholm Declaration? How do you, in your work, connect with different fields? What is really your main call? And these, what you see here on the screen, the right to be safe on our roads and the protection aspect came out very strongly as something that our members read into the Stockholm Declaration. They also calling for the 50 by 30 and then the whole support and the transforming the streets, the mobility aspects. And what we see here is quite interesting because it's the right aspect coming out. And that's something new that people are calling and seeing safety as a right. I think the whole culture aspect that Claes just briefly touched on is something that is expected as a safety culture. And the right, we know that some countries actually has safety as a constitutional right. In Mexico, for example, has safety as a constitutional right. So it's moving towards that, the right to have a safe journey, the right to go to school in a safe way. And we know all this because we have seen, we know how safety impacts. There's so many connections to poverty, for example, to employment, to education, and those that are rights. And it's transport and safe mobility connect to these things. So the right aspect that you see here in this campaign is quite interesting that it's coming out. If you give us the next slide, I'll just want to show you some of what it looks like, our campaign. And you can see this hand, the hand from the Commit to Act. If you go to Facebook and see some of our, and by chance are friends with some of our members, you will see many of them have this hand, the rights to safe roads. If you give us the next slide. This is another aspect of the campaign where we are asking for commitment from governments. Again, this is a commitment to something specific. It can be going from a country committing to a reduction of fatalities by 50% by 2030, but it can also be a very local commitment to a piece of infrastructure outside a school, for example. This is on our website. It's quite interesting. You should go and explore if your country is here. And if you are connected with your government, some of your decision makers, this is your chance to get them to make a commitment and put it up here, and thereby make it public that your decision maker is actually committing to this. So that ties back to the sponsoring of these of the UN resolution. I think that was what I had. Yes, thank you very much. And I really encourage you to go to our website and explore our members, who they are. It's a very dynamic group, and welcome to AAA as a member. Thank you.
Thank you, Lotte. Very, yes, very informative. Okay, our next presentation is from Dr. Blair Turner. Blair will also talk about road safety in low and middle income countries, some of the key issues and potential solutions. Over to you, Blair.
Thanks, Brian, and thanks also to the audience for taking time out to be part of this really important conversation. And as we heard, 1.35 million deaths per year around the world. It's actually 93% of those occur in low and middle income countries, so about 1.25 million deaths per year, plus all those serious injuries that also occur. So it's a massive toll, and it really draws back in terms of our efforts to reduce and eliminate poverty and this sort of shared prosperity agenda that the World Bank holds. So it's a very important part of the activities from the World Bank. If you go to the next slide, Brian, the main focus, I mentioned briefly about the facility itself and what we do, but I really want to contrast two reports that are one in preparation as a draft, and the other that was released earlier this year as part of Stockholm. So the first one there is a bit of work we're just finalising now on what actually works based on the evidence, in particularly in low and middle income countries. What are those interventions that actually make a difference? And I'll contrast that with this other report which has been published that looks at the 125 low and middle income countries and talks about some of the issues that they have based on data and information that's been gathered from multiple sources, including the World Health Organization, some UN agencies and others as well. So I'll do that contrast between those two reports. Go to the next slide. Just very briefly, facility's been around since, well, more than 15 years, and it's hosted by the World Bank. Really, the main core of what we do is to provide technical support, build capacity, but we also conduct applied research around this area of road safety in these sorts of countries. Look, you can certainly Google the facility and learn more. There's an image there which shows some of the countries in which we work and the types of projects, but it'd be fair to say the main focus would be really around infrastructure. The World Bank itself spends hundreds of millions per year on helping countries improve their infrastructure, particularly around roads. And so the role that we have there is making sure that's done safely, and that's through some recently developed safeguards to ensure that safety is embedded in projects. But it spans across also other elements of road safety around enforcement, but even to the vehicles and post-crash care as well. So the next slide there, Brian, thanks. The report I mentioned is basically evidence-based, except there's one area we cover which really is based on best practice. There's not much evidence in terms of exact benefits from these solutions here, but I'll present based on pillars of the SAFE system, and many of you will be familiar with those. So I'll go through firstly this road safety management pillar. All these different pillars work together, so I just want to point that out at the outset. I'm showing these as more of a structure than they shouldn't be done in isolation. I won't go through all of these to go given time. I'll just touch on a few of these, in particular the bolded one there. But essentially, some of the things that work to improve road safety management in LMICs, we, as a first step, often go into countries and conduct a road safety management capacity review. This is really a deep dive on current structures and the performance of different countries, using expert groups and in-depth consultation with local agencies. And that then leads to some recommendations about how we can make a start or make an improvement in those countries. And one of the first recommendations often is through the establishment of a strong leadership platform, a lead agency in these countries. And the shape and form of that agency does vary, but certainly we need that strong leadership in any country to actually bring together key stakeholders and plan and execute activity. What I did want to spend a bit more time on this slide was around the data strategy. So as part of a performance framework, we really need good quality road safety data to understand our problem types, put in place plans to actually address key risks and monitor our progress towards targets. And that does require really strong data. And this is one area where we do really lack in LMICs. And it's an issue around the world. In terms of fatal data collection, we know that around, in high-income countries, we're missing perhaps 10% of all our fatal data in our trauma registry systems and in other systems. When it comes to the middle-income countries, those who are less wealthy, but not the poorest of the poor, they've only recorded perhaps around 50% of their fatal outcomes. So there's a big, massive gap in terms of the data they have. And the poor, low-income countries, their underreporting is substantially higher than that. So they're probably only collecting around 15% of all fatal outcomes in their data systems. And that's just the fatals. We also want to know more about the serious injuries as well. And so there's a very, very big gap there. And certainly we're talking about the AAAM and the expertise from the membership base there. There's perhaps a role in terms of help around capacity building around these data systems, and training is a big gap there. Certainly need to build capacity, training exercises, and it's really the long-term sustainable training that's required though. So no, dropping in and doing one presentation and then disappearing again. It's really going to be ongoing and sustained, building relationships, and I guess establishing connections and networks, and that's definitely part of what we try to do. The last one there is about strategies and targets, also very important. Next slide, please, Brian, and I'll contrast that against what's actually being done. So this is based on the data I mentioned earlier. I'll show several of these tables, and they all have the same form, that they have as columns on the left-hand side, LICs as low-income countries, and on the right-hand side is middle-income countries. And this really shows the progress of our snapshot from earlier this year. And I mentioned earlier the importance of a lead agency. We're doing okay in middle-income countries. There's huge room for improvement, obviously, and certainly in the low-income countries. There's many countries that just have no structure around their safety activities. Similarly, around safety strategies, only around half the countries in low-income countries have got a strategy, so have any direction in terms of their activity. Funding obviously is an issue, and Claes touched on that earlier as well. So not having a strategy is one thing, but not having any funding to actually move forward with that is another issue as well that we've identified. And we know that setting targets, those countries that do set ambitious targets do tend to perform better. And a vast majority of low-income countries have no targets at all, and only just over half of those in middle-income countries. Next slide, please. In terms of safe roads, this is an area where we do spend a lot of our time. We know the major crash types in low-income countries, middle-income countries, and they tend to be pedestrians. Where we see cycling and motorcycling are always high on the list of fatals and serious outcomes. Single vehicle loss of control, intersection crashes. There's others as well, head-on crashes and manoeuvring type crashes as well play a role. Infrastructure can play a big role in all of those crash types, and from the very simple, and the image down the bottom there of a footpath, many crashes in the LMIC context happen with people walking along the road, on the road itself. And so just simply allocating some space at the side of that road can have a massive benefit and improvement in safety outcomes. So there's solutions across all these different crash types. I won't go through them all. Separation, speed reduction, I'll come on to again in a moment. But I guess the overarching thing is to have a structure in place to assess road networks, look at, in a systemic way, the types of risks you're having, and putting in place mass action programs to address those risks. So if you go to the next slide, Brian, I'll just show you where we're tracking with that. We're doing reasonably well in terms of assessing new road developments. Still, again, big rooms for improvement there, but this is the idea that we might actually design roads and then do a proper safety review on that new design. This has been an area where we've been pretty poor historically, but it's improved reasonably well over the last few years at least. What's less advanced is the assessment of the current network. And very few countries, in terms of the low-income country context particularly, have a process whereby they actually inspect their roads, understand the risks of those roads, and in a proactive way go and treat those risks. So again, there's a quick win to be gained there, and a role for our engineers and our planners to do that. And again, the funding issue comes up that many countries don't even have an allocation to address high-risk locations. And there's some very, very quick wins to be made here. We know the investments in infrastructure can produce benefits for every dollar spent, an average around sort of $6 to $8 return in terms of the benefits you gain. But it can be much, much higher than that. It can be 30 times the investment we make. So some big wins to be gained there in future. Next slide, please, Brian. Speeds is really the major issue for us, and Claes mentioned that 30 km per hour and vulnerable road users. We also know that there's issues at intersections, and we know the speeds that are survivable at intersections and around that 30 kilometres per hour speed. And we know for our rural roads as well that high speeds, particularly above 70 kilometres per hour, if vehicles collide at those sorts of speeds head on, or above those speeds, then there's a high chance of death and serious injury particularly. So speed management certainly at key locations, but across our networks is absolutely critical. I won't go through all these different solutions, but again, we know the solutions. We know what works. We know exactly the benefits they'll bring. And with speed and speed reduction, appropriate planning around our networks and putting in place infrastructure to support the speeds we're after, and that's speeds that match the road use. These can have quite dramatic impacts in terms of safety improvements. Next slide, please, Brian. In terms of how we're progressing there, it's, I guess, encouraging that many countries do have national speed limits laws. I guess that's a little bit misleading, though, because the level of enforcement can be very minimal in a lot of countries. What is probably more startling from this graphic here is the number of, or percent of countries that actually have appropriate speed. So we mentioned that 30k or below, where there's vulnerable road users particularly, and pretty much no countries have those speeds in the low and middle income country context. So some immediate room for improvement there. I mentioned the rural networks, where this is away from the motorway network or the freeway type network in rural areas. Speeds at or below 70k per hour we know are survivable and safe, and again very, very low percent of roads in these countries have those sorts of speeds. And then on those higher quality roads we can have higher speeds, 90, sometimes even higher if they're very, very well designed. But again, when we're putting in these motorways, often with not the best of design, we're seeing that many of them are a lot higher than that 90k per hour. So again, a big task for us there to improve knowledge, but also activities around safe speeds. Next slide, Brian. Safe road users, again, we know a lot of what works here. Seat belts, speed enforcement, alcohol enforcement, wearing your helmet, not just putting it on the front of your motorbike or bicycle as well, potentially. So all of these things work really well, and the knowledge base is pretty solid. And that's reflected also in low and middle income countries. We know from a licensing system, there's methods there that we should be using. Many countries, the license system is go and pay for your license and walk out the door fully able to drive. So that's not appropriate. We know that the better way to go is using a graduated licensing system whereby you've got a period of on-road supervised driving, many hours where the young drivers can actually gain experience. And then often a two-staged approach whereby once that initial license is attained, they have this provisional period where there's actually restrictions on their driving, whether it be time of day or the types of passengers in their vehicle or their ability to drink at all. Obviously, enforcement is a big part of the equation, and that should be supported by education, training, and publicity. So if you go to the next slide, Brian.
Blair, we're getting a bit short for time. Could you speed up a little bit? Sorry.
Sure. Yep. Okay. I'll just quickly duck through these and pull out some main points. Again, the key point here is yes, there are countries with seatbelt laws, but very few with them in the front and back. So big room for improvement here. Big room for improvement around drink drive enforcement and random breath testing as well. So if you move on, Brian, to the next slide. Look, I won't go through this, but there are some things we know that don't work that are still being used, and I'll just use the one example from the image there. You know, off-road training for young drivers, where you make the road surface slippery and give people the chance to practice loss of control and how they might recover from that. We know from many evaluations that that doesn't help driver safety at all. In fact, what it does is it instills a sense of overconfidence in drivers, and they'll go away from this training and they'll actually be overconfident, and their risk can actually increase. So just be aware there are certain things we need to do better, and just be aware of the evidence base about what does and doesn't work, particularly in the safe road user space. Next slide, Brian. I think you probably know about the safe vehicle features, improved vehicle specifications, improved vehicle maintenance, the seatbelts I mentioned already. Look, new vehicle technologies really will be a big one for us. We're seeing massive potential there. It will take a long time for that to be implemented in low and middle income countries, but we need to keep our eye on the long-term game there and assist countries to bring in vehicles that have these advanced features. And many of these countries have very, very old vehicles. We need to put in place systems whereby the specifications for vehicle import or production are a lot higher. Next slide, Brian. And how we're tracking there. Only half of the low-income countries actually have regulations around import of used vehicles. Very, very low periodic inspection. So, you imagine these trucks that are used as passenger transport vehicles, just no inspection on those vehicles and their safety, and you get a lot of countries where there's large number of deaths in one crash where there's failures in the vehicles, and similarly buses and other vehicle types. So if you move on, Brian, post-crash care, I think you know well about improving our response times, the expertise and the facilities are all very, very important. If you go to the next slide, Brian, and how we're tracking there. Very simple, have a national phone access number where everyone knows which number to call to call on the emergency services. Only around half of low-income countries actually have that. The trauma registry systems need to be improved, obviously. And that bottom figure really shows how we're tracking in terms of healthcare. The higher the percent, the higher the healthcare level, and obviously it's very, very low in those low-income countries. So last slide, Brian, just to wrap up. Look, we do know what works. We've got the evidence base, and a lot of it's based on high-income country knowledge, but there is an emerging evidence base from the low and middle-income countries as well. There's really some significant gaps. Many of those are institutional, and I just called out earlier the data gaps, and that's potentially a role for those on this call and for AAAM to be engaged in. Similarly, there's a really strong need for capacity building. This presentation really is about showing we do have the evidence base and the knowledge base, and a lot of this isn't funding, it's knowledge. We need to really help in a sustainable way build capacity in these countries. And so I'll leave you with the question of how can you help with this activity and really try to address those 1.25 million deaths in low and middle income countries every single year. Thank you, Brian.
Good, thank you, Blair. Let's move on to our last speaker for this session. So Olive, you're going to tell us about some of the key issues, particularly in regard to that last slide of Blair's, I think. Over to you.
Thank you. Thank you very much for this opportunity. Yes, I think that was a good way to lead into my presentation to talk about post-crash care. Next slide, please. Brian?
Yep. You're not getting the slides? Oh.
No.
Can others see the slide? No?
Perfect. Okay, that's better. Thank you very much. Right, so I guess we're talking about the next 10 years, but I want to take us a little bit to something that was finalized in November 2017. The UN member states completed a process of agreeing on global voluntary performance targets for road safety risk factors. And target 12 said by 2030, all countries should have established and achieve national targets in order to minimize the time interval between the road traffic crash and the provision of first professional emergency care. Now, before I go into the details, I'm going to tell you a short true story that concerns people that I know not very well. So in Uganda, it's very common for people to hire private security guards. Sometimes they'll hire them for their homes or office premises. Now, towards the end of 2019, one such private guard, 39-year-old Felix, was going home in the night, and he was hit by a car from the back. He said he didn't see the car coming, and apparently it was not witnessed. The driver didn't stop, but Felix was hit and he flew into a roadside ditch, trench, and he lay there all night. It was a dark, rainy night. He was completely soaked, unable to move. And in the morning, once people started to move about, he called out, and some good Samaritans came and pulled him out of the trench. And they attempted to put him on a motorcycle, but he could not sit on a motorcycle. One of his legs was really dragging and he was in agony. So they called, used the phone numbers that he had on him and managed to reach his employer, who knew somebody that knew me. So I got a phone call and somebody said, we have this man, this is his situation, what do you advise? Actually, the spot at which Brian was hit was 1 kilometer away from a health center, but it was only 6 kilometers away from a national referral hospital. So I listened to the story and I said, look, forget about the health center, just drive him to the national referral hospital. I think that's where he'll get, the best care. So I got off that phone and I called a colleague a surgeon who worked at the national referral hospital. And I said, Jackie, there's a patient coming in. This is what he's like. Look out for him. About 2 hours later, Jackie called me and said, Olive, I've seen the patient. He came in. He was in early shock. He's coming up nicely, but he needs an operation. I said, oh, great. He's in good hands. She said, well, not exactly. She said, he needs an operation. He needs an implant. So his bones are broken. He needs a rod. It's like a rod that goes through his bones so that they can be stabilized to heal properly. And she said, we don't have any implants in stock. That's not so we called around all the public facilities in the city and nobody had any implants. There were implants, they were just in paying hospitals. And Brian and Felix didn't have the money. And so by mid-morning, his family had heard about it. His wife was there. And between all of them, they didn't have the money to buy an implant. It cost about maybe the equivalent of 4 months of Felix's salary. So they went off to try and find the money. So fast forward, 3 days later, Felix is still lying in hospital. He still has no money for the implant. His family come in the night and take him away. And he ends up at a traditional bone setters clinic. So he's there, and today Felix is alive. So that's the good part of the story. He has a shortened right leg and he's walking with the aid of a cane. So clearly he's unemployable as a private security guard. He's out of money, but actually, comparatively speaking, he got a good outcome because he has survived it. His wife is not a widow. His children are not orphans. He has the opportunity, hopefully, to find something else to do that's different. And I say he has a good outcome because in 2019, we estimate that over 7,000 people lost their lives as a result of road traffic crashes in this country. So Felix was not one of them. But now let's go to the next slide. Brian, next slide, please. So this framework, I think many of you would have seen it. It was popularized by the World Health Organization, and it talks about emergency care system framework. So from the left, it walks us through what ideally should happen when somebody's in a crash, to the right, to the extreme right, where they hopefully recover and go on to live their lives. So at the scene of the crash, ideally, if there was a bystander, they would have activated a system, they would have activated an emergency care system. So there would be a dispatcher who would send a provider that's trained to look after injured people. They would come in an ambulance, they would transport the patient, who would then get handed over. So there's a phase in transportation where there's not just the driver, but the person who's able to provide care during transportation. And that care provider then hands over to another provider at the health facility. And then the patient gets taken into this system where they undergo triage. There's, a determination on the priorities concerning his injuries, how severe, what kind of specialists need to look at him, and so on, if he needs ICU or the operating room and all of that. So if we could go to the next slide, please, Brian. So clearly, in Felix's case, there was no bystander, at least none that we know of, and there was no system to activate. So even if there had been, there wasn't a system that could help Felix out. There was no provider at the scene. And if we go to the next slide, so there was no ambulance. And the first attempt was to put Felix on a motorcycle, on a commercial motorcycle, we call them border borders, but that wasn't possible because of his injuries. So then eventually a Good Samaritan drove him in their private car to the hospital. And if we go to the next slide, so there was a handover, but it wasn't from one trained healthcare provider to another. And if we see the next slide, actually, we realized that there was a barrier right there, that although there was a provider, if we go to the next slide, the fact that Felix didn't have money. So once he was in the facility, he needed to use the operating room, the operating theater. And if we click again, Brian, so we see that ideally we expect that there's an operating theater. And remember the target that we started off with, that how can we shorten that interval? Now we come to an operating room that is staffed, but it actually doesn't have the equipment that we need. So then we look at this whole chain and we have to ask, next slide, Brian, what went wrong? What went wrong for Felix, but also what goes wrong for, so if I said in 2019, we lost maybe 7,000, upward of 7,000 people on the road. And what if 50% of them didn't actually die on the scene, but they died as a result of not having post-crash care? What would have gone wrong for those people? That there was no emergency medical service. This is happening all across the globe in low and middle income countries. The access to care is unorganized. It's maybe you wind up in a good hospital, maybe you wind up with a surgeon, but maybe not. Maybe there will be an ambulance, but maybe not. Maybe you have a motorcycle. There is no health insurance, and out-of-pocket medical costs are way too high for majority of people that live in these countries. So there's no safety net for patients that can't pay upfront. And even when equipment is available, as in Felix's case, it might not be affordable. So if you could have the next slide, please. So this is what the situation was in 2016, and this is straight out of the 2018 Global Status Report on Road Safety, where, and I think this relates quite a bit to the previous presentation, that 109 countries, that's 62% of the 175 countries that participated, have a phone number with national coverage to activate the emergency care. Now we need to think through Felix's situation. So he didn't have a phone on him. So even if there'd been a number, it wouldn't have been helpful. But actually, if Uganda is anything to go by, it's quite possible for a country to say, we have a number. They decide it's a number, but that number doesn't really mean anything because behind it, there is no functionality. 55% of countries have a formal process to train and certify pre-hospital providers. And again, it's not rosy, but it's not too bad. It's more than half of the countries that have a process, a formal process. And we need to think, so how many such people are trained per population? How many are in existence per population? 45% of countries have trauma registries. And we could say a whole lot about what does a trauma registry mean in terms of ability to plan trauma services and to actually deliver them, for them to be meaningful. For a trauma, the National Referral Hospital that Felix was taken to actually has a trauma registry. And less than 25% of people have access to a staffed operating theater within 2 hours of a road traffic crash. Felix was only 6 kilometers away from an operating room with more than one surgeon. They just didn't have what he needed in order for him to get good care. If we could, next slide, please. Yeah, so Lotte talked a lot about this, and so I only just say, indeed, that the resolution does very specifically say for member states to strengthen pre-hospital care, including emergency health services, and the immediate post-crash response. So there's a specific call in this. And if we go to the next slide, I think the question will have to be, what will it take for this to be the reality? So following the 2016 Global Status Report on Road Safety, there was a process to work on not just the targets, once the targets were in place, to work on indicators, and that process is still going on. But I think we need to now look within countries over the next 10 years to say what else needs to be monitored that is not being captured in the current reports, that actually tells us truly what is going on with post-crash care and how can we improve? Because I think the financing is going to be absolutely critical, and we need to be able to track in country what financing is going to post-crash care and what access there is. How are patients able to access this care if we are to make any meaningful progress in this area? Thank you very much.
Good, thank you, Olive. Run over a little bit of time, but I think all of those presentations were excellent, and thank you all for doing that. Frank, can I pass over to you now? Could I ask each of the speakers, please, to put your videos back on and to unmute yourselves, and I will.
Yeah, thank you, Brian.
Question 9.
Yes, thank you, Brian. What a fantastic group of presentations. I think we are taking all of that in and being able to go all the way from preventative measures to post-trauma care. It's wonderful. Let's just take a few of the questions. One of them might be easier to answer from Dr. Mutiso. In Kenya, the speed limits are 40 km/h urban and 80 km rural. Are there actual speed limits based on, are these actual speed limits or the safe speed limits based on evidence that they should be changed? So I think, Blair, I think did you want to answer that one?
Yeah, sure. Yeah, I mentioned the evidence base we have in road safety, and I think probably the strongest information we have is around the impact of speed and what safe speeds are. So we know the mechanisms by which speed has the impact on safety outcomes, and we know the safe speed. So certainly the research base is growing around our knowledge. So in urban areas where there's vulnerable road users, 30 kilometres per hour is a reasonably survivable speed, and we can even avoid, in many cases, serious injury outcomes at that speed. Above that speed, though, the chance of death and serious injury rises dramatically. So, look, 40 is a great start. You know, many countries have got 50, 60k speed limits around vulnerable road users. You know, they're in a really bad shape. So 40 is a really good start. But you know, 30, particularly, you know, starting around schools, around activity centres where people are shopping, around education institutes, particularly with these vulnerable road users gathering, 30 is most definitely the recommended speed. And if we get the speeds down around that level, when things go wrong, then people will survive that. And if you want higher speeds than that, then put in place the infrastructure to protect the road users. So if there's separation and the pedestrians and cyclists have got their own space, then you can go for a higher speed, but you must have that infrastructure support to do that.
Yeah, thank you. Klaus, do you have anything to add to that? I know you talked about speed as well.
Yeah, thank you, Frank. It's a good question where we as a community, the research community and traffic safety community, needs both to be strong and understand what we're talking about, but also to find the allies. Because first of all, in terms of road safety, I mean, there's a continuous deep function in relation between impact speed and the risk of a fatality or a serious injury, as was just pointed out by Blair. But also knowing that for things like particles, air quality, noise, but also accessibility, the possibility for children to walk to school, to bicycle and things like that are also very much related to the travel speeds. So there's a whole bunch of things and arguments that in the end leads up to a more livable, or the livability of the urban areas, that I think we should be using. So once again, this is in today we can talk so much more about all the qualities you achieve through improved safety. I think we shouldn't forget about that, and I think we should find the allies. Thank you.
That's great. Thank you. Someone originally asked a question, I think in your talk, Klaus, but I think anybody can reach out. This is probably less due to low and middle income countries, but in Poland, there's 60 children died in car crashes in Poland, and a relatively high number in adult fatalities. And Poland is considered a more of a higher income country. And in your opinion, what could be the reasons for these? There's another question regarding COVID, and I don't know if this is related, but there's certainly a lot of reasons why children and adults still die on the roadway, and I think that brings up. But does anyone want to field that question regarding Poland in particular, if anybody has knowledge about that?
Can I can start off just by commenting. I mean, I'm old enough to remember when Sweden, with today 10 million people, we had 150 to 200 fatalities among children. That's 40 years ago or 45 years ago or something. Now it's less than what I have on one hand. It takes a long time, but I think among children is one of the areas we've been most successful. I think in general in Europe we had a reduction about 95% of the deaths of children. Some of them to the price of children's accessibility and health, I should say then, by being brought to school and activities by their parents and things like that. So there was a price. On the other hand, if you talk about child occupant protection in cars, it's so much better today than what it used to be. And we know, for example, we're facing child restraints almost reduce or eliminate deaths among children. So there's a mixed picture of it, but we know what to do. And as many of the others have pointed out, we know the medicine, the question is the treatment. But we should be more looking at the after effects or the side effects that we have created to some extent and try to work with them much more than what we've done before. Thanks.
Yeah, thank you. Anyone else want to comment on that one?
Just briefly.
Olive, oh, sorry, Olive, did you want to comment on that? You're muted though. So.
I was actually going to comment on the COVID-19 one, so I think I'll let Claes go about. Okay. Shall I?
Blair, did you want to finish the comment on the Poland question?
Just briefly, yeah. So look, certainly Poland has made a lot of progress in recent decades. The numbers have gone down generally pretty well, but there's a lot of room for improvement there. I'll just make a quick point that really it's about assessing what is going wrong. There are certainly some systemic things you can change that will have a improvement across the board, but the starting point you're looking at those children particularly as, what are the situations in which these problems are occurring? Is it walking to school, for instance, and therefore is it around infrastructure around schools, or is it children in vehicles and therefore the seat belts and rear-facing restraint systems? But it's probably all of those things combined. But a bit of knowledge around what's going wrong is a great place to start.
Great, thank you. And there was the question on how COVID-19 from Judith Charlton, how it's dramatically and positively impacted some behaviors of individuals and industries and governments, including a modal shift, exposure, and reduced deaths. And I think that this is perhaps, the effect is probably different in low and middle income countries versus high income countries. I think that it's an interesting question on how the panel might think that COVID has affected the road traffic deaths issue. Olive, do you want to answer that one first?
Yeah, thank you. So I thought it was interesting. The question said it positively impacted behaviors. And it's true that I think initially in many countries, there was a tendency for people to walk more and to use their bikes more. But I think in low-income countries, certainly in Africa, that the difficulty has been that most commuter transportation is very crowded. And so when you're trying to get distancing to work, and people don't have many options. We don't have the option of converting wider streets into cycle lanes. So I think the challenge currently is how do we operate our commuter transportation, which is usually a 14-seater van that carries 20 people, or a bus that should ideally carry 45 people that carries 90. And how do you do that and still have some form of distancing, which is impossible. And I think that this is a wake-up call for low-income countries to say that unless we build resilience into our transportation system, it's not just, the risk isn't just road traffic crashes, the risk is also disease transmission. And I think that the challenge for high-income countries might be different, that you're trying to discourage people from going back into a private vehicle and you're encouraging them to instead cycle more, but it's because the infrastructure is probably able to support safe cycling or safe walking. But I think for all countries, as indeed is pointed out by the resolution, the idea is to build resilient systems that can allow us to have more active mobility.
Yeah, thank you. That there is quite a difference, I think, in different countries. Lotte, do you want to?
Yeah. Some of the things that we have heard from the Alliance members in low and middle income countries is actually sort of around first of all, that what people saw when the pandemic started was clear blue skies, empty streets. Suddenly there were
clean air,
walking, cycling. All the things that we have advocated for such a long time was suddenly happening in front of our eyes. I think there was sort of a optimism around that it's actually possible. It's like there is everything that we have been fighting for and what we have tried to make happen over so many years is actually suddenly there. Not everything, but a reduction of fatalities, and we've seen that. So I think that optimism that it is possible, of course, with a backdrop, a very serious backdrop. I think the second thing that we have heard is opening how people have actually seen that the connectivity between the issues. So that if you address road safety and if you address these things, you also address a lot of the other SDGs, and the connectivity between the issues, that the gender issues and in poverty issues and urban planning and mobility, all these things, how connected they are. I think that's the second thing that we have seen sort of dawning on people. And then I think what we have actually seen is an introduction of critical thinking, and critical thinking in the sense that you know, there's a restriction, as Olive says, you know, you have to have social distancing, but you know, I can't take public transport unless I'm in a crowded bus. I can only take crowded buses. For example, we have seen people saying, you know, I want to walk on a sidewalk or on a pavement, but I have to step out to the street if I want to social distance. So the critical thinking around why a car, if you look at the street is that big, the pavement is this big. Why is it like that? And how do we sort of address these things? So the whole aspect of critical thinking has been quite interesting to see. So I think if some of the lessons learned that we have seen is around the connectivity with the aspects of the critical thinking.
Yeah.
And then that is possible.
Yeah, I did want to ask the panelists, and this question also comes from Maria Sagui Gomez. She says, "Dear panel members, thank you for bringing a thorough review on your varied experiences working in low and middle income countries. And since AAAM is a scientist-based organization, what topics or priorities, from my standpoint, would you consider are priority areas of research for their members in the near future?" I think we talked about this a little bit when we were first getting online, and AAAM as an organization, it's part of our mission to help reduce road traffic injuries and crashes in all around the world. And so I think from your expertise, where should we as an organization get involved?
I can start if you like. And great question, Maria. Hi, Maria. I think, you know, there's a bit of a history from AAAM around data and injury surveillance type issues. The AIS measure particularly. There is, as I mentioned in the presentation, a massive gap in low-income country context around our knowledge, I guess the training, sustainable training and capacity building around those sorts of issues. So there's some research questions there, but also that capacity building side as well, which I think there's probably a very, very strong role for members to, you know, seek opportunities for engagement, because that certainly is one of the areas we need to start and move on more. And I would say just one more thing on it, that there's now right around the world observatories set up in Africa, Latin America, and now Asia Pacific as well, where it brings together all these countries to share experience and to capacity build. And one of the main focal points of those groups is around these sort of data issues. And so there may well be a role to be engaged at that level, and that way you can cover off on, you know, multiple countries at one time. So that's just perhaps a starting point.
Great. Yeah. Anyone else want to?
Yeah, it's a great question, and an important one, and I think with a long tradition of with the AAAM being at the forefront of scientific rigor, knowledge, and exchange, with sort of the new policies coming out where we need to broaden into other sort of core things in like climate and equity and things like that, but also so many more stakeholders coming on board, which are, I mean, you can't blame a city somewhere, you can't blame a company somewhere for what they're doing, and because they don't have that sort of scientific understanding and knowledge to do the right things. They can do what Blair said, for example, a big company wanting to reduce their safety footprint might send on their drivers to some advanced driving course, which is at the best doesn't create so much more mess, but in some situation actually could lead to a worse situation. And you can't blame the company because they don't have that scientific knowledge. So I think what AAAM, as one of the major organizations of the world in terms of scientific knowledge, should be there, clear, giving the kind of advice we need in the world, not getting into the situation like climate is in some countries, in some situations, but really to stand up there and say, you know, we're going to protect the world from being hit by something we know the medicine for. I mean, based on the COVID situation and things like, it's the same there. Who do we really wish to listen to? Well, I'm sure most of the public want to listen to people who knows something about the facts about it and not the beliefs or whatever it might be. I think you're going to play a very important role in making sure that we are using that kind of knowledge.
Great, thank you, thank you.
Frank, can I just quickly ask Lotte, given
Yeah.
that you mentioned that AAAM is now one of the new members of the Alliance, what your thoughts would be, Lotte, in terms of how AAAM could contribute to your activities?
I think also, I think there's a lot of, we have seen a transition amongst NGOs from being very, we have a very enthusiastic group of NGOs who would jump on whatever was, what they saw as a problem and what they saw as an issue. And I think the fact that we have started sort of seeing much more evidence-based programming, for example, is very interesting, and that's definitely where you can bring in your expertise. One of sort of my strong calls is always that it's great to do research. It's very needed that we do the research and we have the evidence, but it's also needed that we build that bridge between the research and out in the praxis. And I think that would be a call I would make, that we are sure that the research doesn't just stay in this room, but it gets out there. And there's a lot of opportunities for that. But I also know that there's a long way for a lot of the smaller NGOs, particularly. They're very keen on doing the right thing. They really, really want to address what they see around them. And if we are not guiding them with evidence, they might do something which at the best doesn't really do any change. So I think making sure that we build those bridges between the research community and the those on the ground is very, very important. And then I'm going to say one more thing, and maybe this is not related to your question there, but more like what one call, and I think Maria will be very happy here. One of the things that I have found extremely interesting and motivating to start thinking around is the culture aspect, road safety culture aspect. And I lived overseas for many years, and I came back to Denmark, where I am now, every summer. And every summer there was something new I had to do, where that was sort of not socially accepted. To, for example, when I left, helmets for bicycles was not something you would wear. I would come back one summer and suddenly people would say, who are you not to wear a helmet when you are on your bike? So it was not the legislation, it was not the enforcement, it was not the police, it was not the fine, it was my friends who were looking down on me when I was not wearing a helmet. And that whole culture around road safety I find extremely interesting. I know it's something Maria is very occupied with and looking into, how can we sort of build a road safety culture. Because if you're looking around countries, you've seen with tobacco, sort of how do we create a culture where it's not accepted to, speed, for example, drink and drive, all these things. I find that extremely interesting. And Maria, I think you will agree with that.
Sure. Frank, we've run a little bit over, and I apologize for that, but the discussion was just so fascinating. I just couldn't stop. So thank you all very much for your contributions. I think it's been a wonderful session. And I don't know if we can applaud or not. Somebody once had a little hand that you could show, but thank you all very much. And thank you for those who are still with us. And I trust that, Frank, you've got a few questions to be answered, so maybe we can follow that up later as well. So thank you all, much appreciated. Bye.